I have been deputized to, the only thing I've been deputized to do is to encourage vaccinations. Other than that, you take everything I say, you can question that, but I do have data I want to present to you, and just to paint a picture of our situation, how the county is responding, and answer any questions that you may have. And if I can't, if I don't know the answer, I'm happy to try to get one for you. And so I can get back to you as soon as possible. So I do want to apologize, because if we were all together in a room, I could put these slides up on a big screen where they might be easier for you to see. I've tried to make these the slides as easy to read as possible, but they are challenging. I do want you to know that what I'm going to do is I'm going to send them to George, and he can share them with all of you afterward. So if you couldn't quite read a slide, or it wasn't quite clear, you can read them on, I will make sure you have a copy so you can see them for yourself. So again, for those who may not know me, I am the communications manager for the county of Sonoma, and I oversee all public relations, marketing, and communications for the county. Before that, I was with Sonoma State. Before that, I worked with the Press Democrat for 20 years, in charge of their editorial board for most of that time. And so I come at it from many different communications perspectives. But I love Sonoma County, and I'm eager to help us do what I can to help us through this latest challenge that we face with this COVID pandemic. So that's primarily our focus today. Let me go ahead and start with this slide. Can everybody see that okay? Let me okay. Okay, can everybody see that okay? Yes?
We can see it fine.
Okay. All right. I don't know why this is I'm having a hard time getting. Okay, well, anyway, we'll move ahead with this. So the first slide I want to show to you, just give you an update of where we are with our COVID situation. And some of this, I'm not going to couch it that we are in a challenging period. Our COVID cases are on the rise. If you remember the blueprint for a safer economy, which we talked about for such a long time, it's if we were still in that, we would be in the purple tier. Our case rate is right at around 19 right now. And you can, these charts, you don't have to read them too closely. They just they're indicative of the story of the last 18 months. And as you say, these are new cases per 100,000. It grew during last summer, it was around this time. And then over the winter, they really peaked. Then with the vaccinations, they dropped considerably. And now we're back on the rise. Same somewhat story with our test positivity and our hospitalization. So as you can see, we were on a roller coaster, and we're back on the upward slope. We have our hospitalizations have gone up considerably in the last month. We're now at 77 that are currently hospitalized. 22 people have died from COVID in the past 2 months. I do want to point out that 90% of those individuals who are hospitalized are unvaccinated individuals. And of the 22 people who have died in the last 2 months, just 2 were vaccinated individuals, both of whom had pre-existing conditions or had other health-related issues. So we can talk more about what's going on. This next slide, let me hold on one second. Okay, that's better. Can everybody see that? Okay, so this next slide shows the really is the story of what's happening right now. This is the blue line here is our the brown line is our what's going on with our unvaccinated population in terms of case rate. The blue line is the number of our vaccinated population, and as you can see, what's really pronounced here is the spike in cases among our unvaccinated population. If we just looked at them, our case rate would be 37 per 100,000 per day. And our case rate among vaccinated is 8.8. Now that's still very concerning. 37 is off the charts. 8.8 is still concerning for our vaccinated population. But keeping in mind that those tend to be, that the vast majority of those individuals are either asymptomatic or have very mild symptoms and are not resulting in hospitalizations per se. But this is and as you can see, the numbers have started to come down a little bit, but we're still not feel like we're out of the woods. So why this sudden spike? Well, you all know the reason. It's because we have this Delta variant. This Delta variant is a whole new beast. It's a whole new opponent, a different virus than we were facing a year ago. This one is much more aggressive, much more contagious, and it's transmissible. And that's what's really led to this spike in cases. And it comes just at the time when our economy, we have reopened. People have been able to go back into restaurants and movie theaters and they're gathering and summer gatherings. And so we are the combination of the two of being able to go back into public settings, and with the Delta variant has resulted in a real spike in our cases. And again, as you all know, this is not something that's unique to Sonoma County. This number, again, the main takeaway from this is that it's really impacting, this latest surge is impacting people across all ethnicities. That these just show the rates among various ethnic groups in our community in Sonoma County. So we're seeing that, and the blue indicates those who are not vaccinated, whereas the green are people who are vaccinated. So among our Latinx community, for example, 83% of those are among unvaccinated, 16 among vaccinated. Our white community, two out of every three people who are testing positive are unvaccinated, with 1 out of every 3 is vaccinated. So that's the main takeaway. Again, I'll be sharing these slides with you, and you can look at these most on your own. But the main takeaway from this is that the majority of cases across all races and ethnicities is that the vast majority of them cases are among unvaccinated individuals. And this is basically just a chart that's showing we do gene sequencing on a lot of the cases that come in. We do not do them on all. We have our own equipment now to do gene sequencing to see what variants we're dealing with in our county. So we have more data to work with, but we don't have the capability to do all of them. But what we're finding is indeed Delta variant is the predominant variant in our county now. This number is 307. Just a few weeks ago, this was down around 40. We've seen a real spike in these cases. And as you know, it's now reported by the CDC that 93% of all infections nationwide are really a result of the Delta variant. And Delta is 60% more transmissible and contains 1,000 times the viral load of previous versions of the virus. And so that's what really the problem we are facing right now. And this is another complicated graphic, but it just goes to show you, this indicates early on that the high number of cases, the dark blue represents the percentage of the cases, the positive cases that are unvaccinated. As you can see, even so, dark blue is still the majority of the cases that are testing positive, but the brown represents fully vaccinated individuals. So you see that we have started to see a growth there on vaccinated people testing positive. 29% of the cases in the last 3 weeks have been people who are fully vaccinated. But again, it's one thing to keep in mind, one, that many of those cases are only contacted through contact tracing because they've been in contact with somebody else who tested positive that may have been unvaccinated. So it's, and many times our vaccinated people that are testing positive are asymptomatic, and they very few end up in the hospital without, except for those who have comorbidities. So, and again, in terms of kind of our racial, ethnic backgrounds, this is the number of cases that we've seen over time. We have seen a real spike in our American Indian and our Black population, and our Latinx. So we've seen real growth in those areas. And the biggest story to take away from this one is the biggest concern we have is the growth of positive cases among our population. Really, it's their 35-year-olds and younger. You'll see that 20 to 29 represent more than 20% of our cases. The 30 to 39 age group represents 17% and younger. And really, this is also, which we'll see in a future slide, these are also the proportion of our population that are the least vaccinated. That those who are 65 and above, we have about 80% of our population in those demographics fully vaccinated, or at least partially vaccinated. But certainly those at 70 and above are the vast majority are fully vaccinated. We're seeing fewer cases in those areas. So and we shall also note that these are the groups that are tending to congregate more, to go out to concerts, and that's really where we're seeing a lot of our spread in large gatherings, in particular in that 20 to 39-year-old age group. And this graph speaks to really where these infections are occurring. So this is hard to read, but this band right here is really from large gatherings, or this band right here is from large gatherings. These are from households. So most cases, people are still getting it from large personal gatherings, from their homes, and some from workplaces. For those that do tell us, there's a large proportion of the cases that we get where they don't really share with us where the infection first occurred. So, but we are experiencing increased cases and outbreaks in case settings like homeless shelters. You've heard about the Sam Jones shelter. There was a significant outbreak. I think that was our most clear-cut example of what Delta variant is doing in our communities. We're starting to see it childcare and youth camps. And gatherings, I noted, gatherings account for about 30% of new infections where we know that the source is known. So, but even large weddings, family friend gatherings, youth sports, we're seeing cases rise in those. And we are seeing some rise in cases coming from bars and other public venues as well. And this is really a breakdown of what age groups we're seeing cases. And again, in that 25 to 39 age bracket, we're seeing a lot of cases emerge from friends and family gatherings. Entertainment is this blue band, so like concerts. You see that in this band. Then you have youth camps, which is this dark band. So this is that this age bracket right here is the most concerning. Some of our older population, there less involvement in camps and concerts, but we do see some cases, particularly among family gatherings, and sometimes those are transmissions that occur because of a younger family member that may have taken part over in this area. So we're tracking all of that data as well. And again, this is really a reflection of where our cases are occurring in terms of ethnicities, and we are seeing the largest growth among our white population. The second largest group is our Latinx population. And I put this one in just because this does kind of give a sense of exposure by occupation. And I think it's interesting to note that there is a lot of workplace exposure happening from our public safety professionals, our law enforcement, our fire, which is part of the reason why Dr. Mace recently just put a health order, which is going to require vaccination, proof of vaccination and/or testing for our law enforcement, fire, emergency management workers and shelter workers, because they are the ones who are often the most exposed. Next group of categories are landscapers. They tend to have a large percentage of exposure. Of course, our healthcare workers are vulnerable as well. And then other manufacturers, laborers, caregivers, and whatnot. So that just kind of gives you a sense of where our cases are appearing. So now to kind of get into the data of what we're seeing most recently, these indicate the hospitalizations, and this is the roller coaster we talked about. Very high at the beginning of the year. This is for calendar year 2021. Obviously, we had very high, rough January and February. Then as more people got vaccinated, things have calmed down. The numbers have started to pick up again. And once again, we right now have 77 patients hospitalized with COVID, 16 in ICU. Over 80% of the COVID hospitalizations and over 90% of our ECU patients are unvaccinated individuals. And 99% of our COVID deaths over the past year have been among unvaccinated individuals. We reported 3 additional deaths just yesterday, and all 3 were individuals who unfortunately had the opportunity to be vaccinated but chose not to. And that's just heartbreaking from our perspective. This again just shows you the kind of the breakdown of our cases in the hospitals. I put this in here primarily to show most recently 29%. We've had people in the 18 to 49 year age bracket. 30% of them have been in that age bracket. This is since the 4th of July, which is a real key date since that comes 2 weeks, about 2 weeks after we kind of reopened the state. 38% have been in the 50 to 60 years older, and 65 and older is 33%. So about a third. Again, most of these are unvaccinated individuals. So, and this again points out sort of the age brackets that we've seen. They're all in the same trajectory, with our highest being our average being around this age group. So anyway, you can study these more. You can study these more as we go. And this is hospitalizations based on ethnicity. Most of our patients are among our white population, and a small portion, but it's probably reflective of our breakdown of our population in our community as well. So it does reflect that. So just in terms of where we stand with vaccinations, as of today, we've administered 635,000 doses. More than 71% of our population is fully vaccinated. Of our eligible population, those 12 and above are fully vaccinated. Another 8% are partially. So that's good. That's still ahead of the state and national average, but it's not where we need to be, particularly in light of this Delta variant. So we're still pushing. The good news is our vaccinations, since this latest surge, word is getting out there. Some of our requirements more businesses are requiring proof of vaccination. We have restaurants now are asking for proof of vaccination before being allowed to be seated indoors. You see a lot of more of that going on, and that has really prompted more people to go take advantage of their vaccine. Anybody who's been sitting on the fence, and so our numbers have been inching up, and that's a good thing. And this is another. I think this chart is important to recognize that because it really shows the vaccination rate by age bracket. And if you see this over here, these are everybody 65 years and above. These three brackets are 65 to 69. This is 70 to 74, and this bottom one is 75 and above. And if you see, everybody in this group is pretty much 85% or 90% fully vaccinated. And that's terrific. And even our 55 to 65 is over 80%. But once we start getting down here to 35, so even 35 to 44 is about 80%, with at least partially vaccinated. But the numbers start to drop off at those under 34. There's about 30% who are unvaccinated without a single dose in our 25 to 34-year-old age bracket, and in our 16 to 24. Now we have seen sharp increase in our 12 to 15-year-olds, and it's only been about 3 months, less than 3 months since they've been eligible for the vaccine. So we're at about nearly 60%, at least partially vaccinated in that age group, but we still have a ways to go. And we really need to reach this group in here who have been eligible for quite a while and just for whatever reason haven't gotten around to be vaccinated. So, and so these are the trends of our groups based on ages. This blue line is our oldest population, 75-year-old plus. The orange is 65 to 74. And as you see, that those have really plateaued, primarily because we're well over 90% for those populations, and there's fewer people to reach. These other groups, there's still some room to grow. We've seen a little bit of an uptick in that 35 to 44-year-old groups, but these are the three lines we're most concerned about. We really need to bring up. We've seen a little bit of a climb in the 16 to 24-year-olds, and we are seeing a climb in this 12 to 15-year-old age group. But that's a group we've really wanted to get them in to get their vaccinations before school starts, because these are still school age children. And it's working, but we're not quite where we need to be. And again, this looks at our proportion vaccinated within each ethnic breakdown. And we have made some great strides in our Latinx community with the help of our community-based organizations and many of our federally qualified health centers. They've really done some great outreach, partnering with the county to reach some of our more hesitant ethnic groups. But we still have work to do. It's still a third of our population in those areas have not gotten vaccinated. And we still have 25% of our white community, 20% of our Asian community, and something similar in our Black community that we have not gotten vaccinated. So, but as they say, progress is being made. Looking at weekly change in numbers vaccinated, the cumulative number of Latinx individuals fully vaccinated rose by 930 between July 26th and August 2nd to a new total of 53. That's an increase of nearly 2%. So we are making progress. And again, this is a hard one to reach, but if you break our community of Sonoma County down into 4 groups, this being the least most economically disadvantaged and least healthy quartile, if you will, of our community, this being the second most, this in the far right being the most wealthy, we kind of want to look at, well, who's getting the doses? And there was a lot of disproportion in this in the early rounds of the vaccine, but we're glad to see that our lowest quartile is really gaining. In fact, there's more of our lowest quartiles getting vaccinated than some of our middle groups. And so we want to continue to work on that. But 69% of residents, currently 25% of vaccine doses have been administered to residents in the lowest quartile of the Healthy Places Index, in which residents have access to the fewest resources. So that's really a testament to some of our outreach and our community-based project partners that they've been able to be successful in that area. So just a couple of recent measures that have been have occurred, and I just want to go over that real quickly. You know about the health order that took effect August 3rd, requiring face coverings in all public indoor settings, including restaurants, venues, gatherings, workplaces. This is all mandatory. You may have heard that today the governor announced that he's also going to require proof of vaccination for all school staff, educators, administrators, janitorial staff. Everybody has to show proof of vaccination or be subject to testing, which is also similar to our own CDPH health order. We are, as I mentioned, we are now requiring all law enforcement to be tested, to show proof of vaccination or be tested at least once a week. We're also, the board of supervisors next week will be meeting to discuss a policy change that we require that all county employees be required to show proof of vaccination or be subject to testing once a week. So again, you can read through these. I won't go through all of these, but this is our new health order that takes effect September 1st concerning fire law and EMS. This is the policy change for the county of Sonoma. And then in addition, Dr. Sundari Mace, our health officer, is encouraging all employers to require proof of full vaccinations or be subject to or show proof of a negative COVID test weekly to come back. So the key takeaways today is that our cases, hospitalizations, and deaths have increased. That's no secret, particularly among unvaccinated individuals. And relative to our population size, a disproportionate number of cases and hospitalizations have been observed in our Black, Latinx, American Indian, Alaskan Native, and other ethnic minority groups. Although post-vaccination cases have increased, hospitalizations and death remain rare among those who are fully vaccinated. That's an important takeaway. We're not saying that vaccinated people are fully protected from this Delta variant, but we are saying that the vaccines are showing that they are very effective in preventing the worst outcomes of this of COVID, and that's a good thing. So, but with this highly transmissible Delta variant in our community, it's especially important for residents to become fully vaccinated. Our health department is continuing to look at other new health orders and policies as a way to combat our most recent surge. So with that, I'm sorry that's a lot to go through in a very short period of time. But as I say, I will provide these slides for you later. And with that, I will stop and open it up to whatever questions you may have. Is that 30 minutes?
Thank you so much, Paul. That was very much on target.
Good.
What we'd like to do is have you submit your question through the chat. And you can say that you want to ask the question directly, in which case we'll try to unmute you. Jeff, you've got a question there. Do you want to tackle that?
Sure. Sorry, I had taken off my microphone. So really granular data, and I appreciate that. This is definitely something I'm going to pour over some more. For all of the data that you have on breakthroughs and hospitalizations, where people are vaccinated, are you tracking results by vaccine, Moderna versus Pfizer versus the J&J?
We do have data available that helps track what vaccines individuals have. Yes, but there's no. If you're going to ask the next question is what does that data show?
Exactly.
There's really nothing that we can draw from that has any conclusions over one vaccine being better than the other. Let me give you an example. We know, for example, that the residents of the Sam Jones homeless shelter, most of them received the J&J vaccine, but and many of those did, even though they were vaccinated, they did test positive. The problem is there's no control group to compare that against those particular cases to say, well, is this better or worse than other vaccines? Because these are individuals who were all gathered closely together in a congregate setting. There was a rapid spread of the virus within that congregate setting, and there weren't people had many different types of vaccines that were there, but the J&J was the majority. And many of them did not, of those 114 that tested positive, I think there were 68 that had been vaccinated, but very few end up being hospitalized. And there wasn't enough data to get to the point that there isn't enough data really draw from that to be able to conclude anything about what one vaccine may have been better again for the other. Does that make sense?
It does. So I'm very interested to hear that it's not such that you are able to start drawing conclusions. There have been various things in the media about whether people who got J&J'd might be seeking one of the mRNA as boosters. And personally, I've been following that very closely because I got J&J'd at the fairgrounds early on.
Yeah, well, I can certainly understand, and you're right, that is a question, and I know some countries are allowing other shots. Our health team is still not recommending that. We still believe the J&J is effective, and we think the evidence shows that, like, even and against the Delta variant. But the questions about, how long does it take before you need a booster shot, particularly for those who may be immunocompromised. I think there's some important information coming out about that.
Okay, and then before I give up the floor, on a similar vein, and I know this would be hard to measure, are you able to include in some of those very granular results people who are pretty sure that they had been previously infected, either showing evidence of a positive test before they got re-sickened, or presence of antibodies before they showed up with positive results more recently? Has there been any work to compare previous cases against vaccinated?
Yeah, that's a really good question. In fact, I was on a call yesterday with some medical experts, and they were talking about this very issue, about whether they can distinguish between antibodies within an individual who's been just previously infected versus antibodies from the vaccine, and whether there's a comparative analysis about that. My takeaway was there's no ongoing local research going on about that issue, but there is research going on at a more national level about that very issue. And the only takeaway that remains, from what I understand, is that they do strongly feel that regardless of whether you've had COVID before, that they still encourage you to not rely on those antibodies, but to still get the vaccine. And but I know there's more national research going on about that, but not necessarily at the local level.
Yeah, I've been party to some discussions where people say, I know I don't need to get vaccinated. I know I had it. And,
Yeah, I
like
think
you said,
I
started
think
at the beginning. It's a new beast, and the advice has been pretty clear.
absolutely, and I think that's even more emphatic with the Delta variant. So I think because we are seeing examples now, we've been at this for 18 months. We now see examples of people who have been infected 2 and sometimes 3 times, and that is concerning.
Thank you.
Hey, Paul, I'm going to pick up on a question here that, let me see if I can rephrase. Here in Oakmont, where we think most of our neighbors are vaccinated, we've been trying to get back to some degree of normal by opening our facilities and people meeting vaccinated with masks generally. So that's everything. You can think about that being everything from a card room with a bunch of card tables and people playing bridge, to an auditorium where you've got 100 people watching a movie, to a fitness center where you've got people coming in and working out. So thinking about this in terms of people who are generally vaccinated and are wearing masks, what are you hearing from the team with regard to where that begins to be edgy versus where that's okay?
I think that's a really important question, George. And I will say that the guidance right now is it's important for everybody to have a good mask when indoors in those sorts of settings, whether you're playing cards or watching a movie, certainly in a gym. But I also know that there's a real concern about that guidance really working for people who maybe may have some other health conditions, maybe including being immunocompromised in some way. And my encouragement at this point is to have them talk to their doctor about what they recommend. Because, as you said at the very beginning, I'm not a doctor. I do know that there's a lot of concern right now about those, our older residents who maybe, be in a difficult situation depending on their underlying health situation. So at this point, the advice is that you're safe in a situation like that. If you're wearing a mask, masks are a great tool, particularly if it's a good high quality N95 mask that's well fitted. They are an incredible tool, and obviously they're no substitute for vaccination. So if you're vaccinated and you're wearing a mask in that situation, the guidance is, that you're safe. But they are concerned about the Delta variant, and they're also, as the previous asked about the potential for a booster shot. We'll know more about where that guidance will come from.
Jackie, you had a question.
Thank you. Can you hear me?
Yep.
Paul, this morning, the New York Times ran a piece on a chart of states, the data on states, it was very strange data, but the two columns that concerned me were the vaccinated people who ended up hospitalized, which we know is a very small percentage with the Delta variant, but the viral load, because the deaths in almost every single state and highly vaccinated states, the rate was even worse. The death of vaccinated patients was anywhere from 12 to 40% if they had been hospitalized. Do you have any local data that looks like that? Yeah.
Paul, you seem to be muted right now.
Okay, sorry, I was having a hard time hearing. So you're saying that the percentage of the death of
among vaccinated hospitalized patients was extraordinarily high.
Yeah, and is that you're saying in other states or in California?
All of them. The 40 states that the New York Times included all had extraordinarily high rates. In fact, the higher vaccination states seem to be doing worse in that category, which some of my friends in the hospital business tell me has something to do with the hospital load. The viral load. I'm just wondering if you're seeing that here.
Well, we do know the viral load on the Delta variant is very high. And we do know that so percentages are a challenging thing because you really don't know what the base number is we're dealing with. From what I have gained and ascertained, both for Sonoma County and statewide, is that the actual number of vaccinated individuals who end up as COVID patients in the hospital is very small. That said, those who do end up being hospitalized often have comorbidities or underlying health situations that have really put them in a dire state. And so sometimes there are tragic outcomes. So, I don't know what the base number is for the state of California of number of vaccinated people, fully vaccinated people who end up in the hospital. But I wouldn't be, I guess I wouldn't be surprised that the percentage of that who end up in fatalities might be high, because I think it's a very small number to begin with, particularly when you consider that, we have 20 million people in the state, 25 million who've already been fully vaccinated. So that percentage is but I'll take a look at that story. And
yeah, I was just curious, and with all the other questions being asked about gathering and everything, I think that what you brought out so well is that the viral load on the Delta is kind of extraordinary. So
it is extraordinary, and it is, and we want to be really honest with people, because I think there was a time when everybody was messaging back in April and May that if you were fully vaccinated, you were Teflon, and I think we want to be honest with people that you're not Teflon with this Delta variant. You're protected from the worst outcomes, But we want people to recognize that there are risks. And the biggest risk right now is still among our unvaccinated population. We want to get people vaccinated. I just to back to your earlier statement, I do want to point out that of the 337 people who have died in Sonoma County from COVID, of those only 3 or 4 were fully vaccinated. And in each of those cases, they involve people who were very advanced in age or had severe other pre-existing health conditions that compromise their situation. So that's the only data I know of to really address that issue here in Sonoma County.
Thank you.
Okay, I've got a couple that I'm going to try and run through fairly quickly, Paul, if I can.
Yeah.
First of all, there's a question about vaccine proof. When Paul is done, I'm going to take just a couple of slides and talk about how you can get a California vaccine proof on your cell phone. So we'll get to that. Okay. Paul, when we talk about what's going on, there's a lot of discussion going on of boosters. And most of the people in Oakmont got their shots before the end of February. So we're beginning to look at people who are, like I am, who are 6 months out and concerned about boosters. Does the county have access to the necessary vaccines that if boosters are recommended, we will be able to get them?
So it's a good question. And I certainly know there's a lot of concern about this, and you're all following the same information we are. I mean, at this point, there is not a recommendation for boosters. That said, it's possible CDC could be recommending boosters, and I know Pfizer is working on that. If and when CDC makes the decision, and the FDA and the California Department of Public Health makes the decision that boosters aren't necessary, and it most likely would be for that 65 and older population, at least at the beginning, they also will make sure that those boosters are available to us. But again, they probably won't be available right away. That said, there's questions as to, well, is this the same dosage as the previous vaccinations? What kind of dose do we need? We have more doses than we can get rid of right now. We would love to be giving out more doses, but we probably don't have enough to handle. And this pure conjecture on my part. I have not been a part of this, but my guess is if the CDC said tomorrow that booster shots are needed, I don't know if we'd have enough to handle that, but we would be making sure to gear up for whenever those boosters are available. But I do want to note that the evidence does show that the boosters are not necessary right now. That the clinical trial, those on clinical, showing that they are still very effective even against these variants, but that over time, Pfizer in particular is looking at there might be the need for a booster to protect future variants and to give that extra dose of protection, particularly for those with weaker immune systems. So
yeah, I mean, Fauci has basically implied that there will be a booster available for the immune compromised.
Correct.
Fairly soon. Testing. Some of us get confused because the alternative, if you haven't been vaccinated for many of these situations, is to get tested a couple of times a week. Do we have the testing capacity to do that?
No, that's also a very good question, and that is a concern of ours. Right now, our demand for testing had really dropped while vaccinations had gone up, and our cases, now that cases are gone back up with the Delta variant, there's more demand for testing. We have upped our capabilities for testing. We just last week, in the nick of time, frankly, we were down to only having capability to do about 1,000 tests a week. We now have quickly boosted that to 10,000 tests a week. But even that, we're finding the demand is growing, particularly among those who, and it's growing among those who are vaccinated as well as unvaccinated. So, and to answer your question, George, we are with this requirement of proof of vaccination or negative test results. There is going to be an even greater push for for tests. And so some of our larger companies, the county, we're contracting with some of these groups such as LHI, Curative, to provide testing for our employees. Some smaller businesses don't have that ability, and they kind of need their employees to take advantage of some of the testing clinics that are out there. And appointments are hard to come by right now. They're not taking walk-ups like they used to. We're basically doing away with the rapid tests because those are not that effective anyway. And PCR test is still the golden standard, and we're basically only doing those at our testing clinics now. So, but making sure we have enough testing capabilities is certainly something we are working on extensively right now, and making sure that those opportunities exist out there. But that is going to be a challenge. Just to clarify, the county policy and the state policy is that workers only need to do one negative test per week, and healthcare workers have to do 2 tests per week. That the healthcare workers are the only ones that have to do it, have to show a negative test twice a week.
I'm going to ask 2 related questions you can answer fairly quickly, I hope. The first one is anyone aware at this point that you've talked to or heard of that there is a home test that somebody could acquire and use?
Yeah, there are home tests that you can buy at the store. I think they're around $50, and they're very effective, but they're also very expensive. And
Okay.
And in some cases, they're not what people need. For example, if you're traveling, the airlines often require documented proof of a negative test within 72 hours of departure. And they often will not take these home tests. You need to go to an establishment that will give you the documentation that shows a negative test. So there's limited ability. Now, whether employers will accept a home test, that's really up to the employer. And I'm not sure what the county is going to decide in terms of the policy. But keeping in mind that $50 each week is a lot. It'd be a lot easier just to go get the vaccine, as far as I'm concerned.
We have a posting here that CNN just announced that the FDA will authorize a vaccine booster for immunocompromised people before the week's out. Okay.
Oh, good. Yeah, I'll be interested in looking at the timeline. We are going to, I'm sure we will meet very quickly to discuss what our supplies are to help meet that demand, and when those, they'll need to authorize, similar to the initial authorization of the vaccines, they'll need to be authorized, and then the state will need to authorize whatever the FDA and recommends for the state of California, and then we'll look at what our supplies are at that time.
Okay, there are 2 questions that are bouncing around, and I'm going to try and put them into one question. Everybody is hoping that conditions will change in such a way that we'll be able to lower restrictions. And in particular, there are a lot of people who would like to have the option of not masking. And these are not people who are, this is just everyday normal people would just as soon not be masked if they could. So there's one question, which is sort of, what's the discussion about what the conditions have to be in order to lower the requirements? But then the other half of it is we're about to go into school. Okay. And there's a whole bunch of issues around whether there will be super spreader events associated with children going to school children not being vaccinated, okay, and therefore being spreading. And you could see a hint of that in the data where you showed how much of the last month or so has come from camp, okay, children at camp. So if you want to channel for a moment the discussions you've been around, how do we think about the potential for a super spreader event and more restrictions, or for things being better and lower restrictions? And what are the kind of gate points we should be looking at?
Yeah, well, to answer your first question, well, let me answer the second one. Yes, we are very concerned about schools starting and the impacts on this. We are committed to getting school children back in in-person education. There are ramifications, health ramifications of not having them, having them in another semester without being in person is there are negatives associated with that as well. But I think people are hopeful that by requiring masks for all students, by requiring stiff protocols and requiring staff to show proof of vaccinations, that those measures will be helpful. And also that by and large, there has been fewer cases among younger children historically. That said, we have seen in other states, we haven't seen it so much locally, but we have seen other states of a rise in pediatric COVID cases, which is concerning. Which is really driving schools to be very mindful of the protocols. Yes, schools are going to start opening next week, and those are the practices that are going to be in place. And we're going to just have to wait and see what happens. There are concerns about super spreader events, and if there are cases that come up, that their schools are committed to jumping on them quickly, quarantining, moving children in certain classes back to virtual learning situations, whatever needs to be to address that situation. But we know it's going to be a challenge, because our 12-year-olds and younger, or 11-year-olds and younger, don't have a chance to be vaccinated, and only 57% of our 12 to 15-year-olds have been vaccinated, or at least partially vaccinated. So we are concerned about that, and we're concerned about that in other areas as well. So going back to your original question, which is, when can we see restrictions getting looser? I just, to be honest, I don't see that happening anytime soon. I think we're all kind of keeping in mind that this is a winter virus, and we're just hoping we can kind of get through this Delta variant surge, get more people vaccinated. We don't have a specific number attached to when we can lower the gates and get back to being unmasked. I know Dr. Mace has made it, he feels that we really, given the aggressive nature of the Delta variant and other kinds of variants, she's feeling we really have to get to that 85% level now in order to achieve herd immunity of any kind. And again, we're only at 79% partially vaccinated or fully vaccinated at this point. So we still have a little ways to go to achieve that. But we're hopeful, and we do get the question: do we think we're going to go back to shutting down businesses and sheltering in place? I don't see that happening. We're not at that level yet, but I think the key indicator will be hospitalizations. That's been the driver all along. Once our hospitals start filling up, it's almost too late to respond, and we really want to track that very closely. So I think we really, that's going to be the key figure to watch each day is hospitalization.
Well, Paul, I think that we've used a lot of your time, and we really appreciate your input. Thank you so much. And I will be posting the recording of this session along with Paul's slides, and then 3 slides I'm going to go through in just 1 second. I'll be posting all those on the oakmontfuture.com website. And I think we'll also have them posted on the OVA website, although I haven't confirmed that yet. So, Paul, I'm going to unspotlight you. You're welcome to hang around while we go further. You have any last comments you want to make?
No, I just want to thank you all. Really good questions. I'm sorry I didn't get to all of them, but I'm happy to be a contact for you if you have follow-up, and I'm happy to come back some other time and give you an update again. George, I'm going to send you these slides as soon as I sign off, okay?
Okay, sounds good. Okay, so I'm going to share my screen. Okay, you should be seeing a copy of my vaccine information. Are you?
Yes.
Okay, so this, the question was, Alan asked the question about what's the mode may be required. You can go onto a site we'll talk about in just a second and get an official California record. The key to the record is that it has this crazy little thing over on the left, which is called a QR code. You see those frequently in various places around the world. And what they do is they contain in a coded manner the information that's on the right. But because this is structured through the state, it is validated by the state. So what that means is this isn't just a matter of my having a copy of a card that could have been, to be honest, fake. This instead is an official record by the state that I got these. Okay, so to get those, you go to myvaccinerecord.cdph.ca.gov. And if you don't want to write that down, it's going to be posted on the oakmontfuture.com website in a few hours. When you get there, you'll need to know the cell phone number and or the email associated with your vaccination account. Okay, and that may not be easy, but it's what you need. Okay, and Colin has put together a very informative video on this on the OVA website. Again, you don't have to copy this down. If you go to the oakmontfuture.com website, you can look at, it'll tell you, you go to the OVA website, you go to members, you click on videos, and you get how to get your record, and he's got a very nice summary. Now, having said all that, there's a problem. A number of people who have tried to do this have discovered that the information the state has is not correct. Okay, that somehow their massive database has got you in it, but it doesn't have it correct. So if that turns out to be the case, what will happen is once you sign up, they're going to say, if we validate this, we're going to send you the link and you'll have your code. And I got mine right away. Okay, but I know at least 2 people who didn't. So the 2 ways you can approach that is, one is to contact the organization where you got the shot, and the other one is to contact the state at the same site where you got the original code. Okay, I would recommend strongly that if you that you do this sooner rather than later, because at some point this information will be required, and if there's a problem, better to identify it now than at the point where it is. Okay, with that in mind, any last questions or comments? Okay, thank you all for participating, and we'll see you next time.
Thank
So
you.
is the organization that, is it Safeway that we would be contacting?
I believe that's correct.
Is there not just the store, but there must be?
I have no idea.
Okay. Heidi, are you on the call? I saw you.
Yes, I am. I am on the call.
Okay. Who would we contact? How would we contact Safeway if we had to do this?
Okay, let me write to Ermine Shende and then to Safeway and see what they say. I'll ask
Okay.
the administrative department on that, and I will get back to you on it.
Yeah, let George know. That's great. Thanks, Heidi.
Yeah,
Yes.
I'll be the intermediary for that.
Yeah.
If you get something, Heidi, actually, whether you do or not.
Okay.
Okay, thank
I'll
you
let know
all.
what I can do. Thanks.
Thank you.
Okay,
Thank you, George.
George.
Thank you, Paul. Outstanding.
okay.
Thank you.